So after Karen's talk, we'll hear from Professor Keiji Fukuda, who will talk about how trade and travel is relevant to us in the Global Health and Development Programme. And after that, we will be talking about the Global Health and Development Programme more broadly and what the programme looks like, some of its key features, and then you'll have the chance again to ask us any questions that you have about the programme, about the overseas field placement, or about the admissions process in general. So before I hand you over to Karen, I'll just give a brief introduction. So Karen Grépin is an associate professor here at the School of Public Health at the University of Hong Kong. She was formerly the Canada Research Chair in Global Health Policy and Evaluation at Wilfrid Laurier University and an assistant professor at the New York University. So Dr. Grépin's research focuses on institutional factors affecting demand and supply of health services, the politics and effectiveness of development assistance for health, and the role of routine health information systems in strengthening health systems. Her research has been published in leading global health journals, including The Lancet, Global Health, Health Policy and Planning, and the Journal of Health Economics. She has a PhD in Health Policy Economics from Harvard University and an SM in Health Policy and Management from the Harvard School of Public Health. So without further ado, I will hand you over to Karen for her talk on trade and travel restrictions in the context of COVID-19.
So good afternoon, everyone. It's a pleasure to be here, and unfortunately I can't see you, but it's wonderful to see 56 people have logged in, so that's heartwarming. Yeah, so today I'm going to talk a little bit about a recent research project. Clearly it's very recent because it's actually about COVID-19, so this is literally something we've been working on now for the last couple months, that I think is interesting in that it highlights a lot of interesting issues in the context of global health and development, and specifically around things related to global health governance. So just to motivate this discussion, I want to start with a number of interesting observations. As you, I am sure, are very aware, COVID-19 has now become a pandemic. It has spread to effectively every country in the world. There have been almost 6 million cases and 400,000 deaths in just a few short months. And I'm going to say that hopefully, because I'm really hoping that this is the case, this is the greatest public health challenge that we will face in our lifetimes. And I hope that is a true statement 20 years from now, when you will be in this field. So what you may be less aware of, however, there is a legal framework that exists at the international level, known as the International Health Regulations, that were specifically developed and adopted in order to increase coordination amongst countries in the context of outbreaks and pandemics exactly like COVID-19. Where this piece of work comes in is that on January 30th, when the WHO, or the World Health Organization, actually declared this outbreak a public health emergency of international concerns, as it does in the legal jargon of the International Health Regulations, it actually recommended against there being any trade or travel regulations. But as of, actually, in fact, as of early April, effectively every member state had adopted some form of cross-border travel measure. And so that's a really interesting puzzle. And so I'm not going to be necessarily presenting a lot of findings yet. We're 2 months into a 2-year project, but rather to highlight where I think there are some interesting questions and to seek your feedback in terms of what you think is interesting, what's not interesting, or if you have any perspectives on some of these challenges that exist. So briefly, I just want to start with a really quick introduction to the International Health Regulations, specifically talking about their history, why they exist, why that's important to thinking about the discussion today. Then we're going to talk specifically about what the International Health Regulations, or the current regime, looks like. And then finally, what's been happening in the context of the current pandemic. I should preface this is a 20-minute talk, so I've decided to restrict myself specifically to travel-related restrictions. There's a whole other piece of work that's being done on trade, and that's a whole other can of worms. So for the purposes of today, I'm mostly going to talk about travel restrictions. So just a little bit of history here. You may not know this, but the reason why there is the global health governance system that we have today is largely because of infectious disease outbreaks. Right? So literally for centuries, whenever there would be an outbreak of a new kind of infectious disease in one geographic area, it would lead to all kinds of political and economic tension between, I'm going to call these countries, but even going back before we had the sort of modern country system that we have today, this could be kingdoms or fiefdoms or city-states that would end up fighting with one another because of these outbreaks. And as long as there have been these squabbles, there have been efforts by countries to impose measures on other countries. In particular, things like quarantine, which is literally dates from the medieval time periods, you know, in terms of putting restrictions on other countries, especially related to trade, right? So where this became a real issue was when I wanted to trade my goods with another country, and they didn't want my goods because they were afraid of there could be disease transmission. Into the early 19th century, there was an enormous explosion of trade routes around the world. In particular, there was big waves of migration of people from parts of Asia into parts of Europe, Africa, Latin America. And we suddenly had, you know, steel ships, which allowed for all kinds of expansion over water. And so there's a big shipping industry that developed. And this is especially true between parts of, say, Asia and Europe. There was, you know, canals being built, and all kinds of stuff was happening to facilitate trade, especially over water. And along with the goods that were being transmitted were the viruses and other sorts of infectious disease agents that countries didn't want to be receiving. And so because of that, and because of that increased pressure from infectious disease threats, we start to see the really early origins of global health diplomacy. So if any of you have traveled, in particular in Europe, these are particularly common. So all over, in particular, southern port cities of southern Europe, you'll find these islands where literally, you know, boats, ships, everything was forced to park for quarantine purposes. Some of them are quite beautiful. This is one of my favorites. This is in the port city of Valletta, which is the capital of Malta. In the background, you can see the main chapel in Valletta, which is a UNESCO World Heritage Site. And in front is this quarantine site, which existed for literally hundreds of years, where they would force all ships coming into Malta to just park themselves there for a limited time period, until they were sure that the threat from infectious disease was down. And so countries, especially countries that had strong trade interests, would begin to converse with the countries that were imposing restrictions on the movement of their goods. And this led to the first sort of formal efforts to develop infectious disease regulations. And so we see the first international sanitary conventions, as they were called, being adopted in 1903. And this was in an era in which there were no formal global health institutions or international health organizations. However, after World War II, when we saw the World Health Organization being established, the WHO was actually given the authority to administer these rules that pertain to how countries interact with one another in the context of infectious disease threats. So in 1969, these rules were renamed the International Health Regulations, as we see this language start to show up. And they were periodically revised from their very early forms. However, no major changes were implemented over this time period. Into the early 1990s, there was a growing recognition that these regulations were not very effective. So So most of them were, so the regulations were focused on particular diseases. You know, they had to decide when they would implement these rules or these policies, when they were relevant. And so, for example, things like cholera, yellow fever were named. And then, you know, even smallpox at one point was listed, and then they had to revise it because smallpox had been eradicated. It wasn't relevant anymore. But in the 1990s, there was a growing realization that there was the possibility of new infectious disease threats. So, for example, although it wasn't new at the time, there was a very big outbreak of Ebola in the Congo, in a town called Kikwit, and a lot of these types of things were making countries realize that they were very vulnerable to the potential of infectious disease threats with pandemic potential. And so there were growing calls to update the international health regulations so that they were kind of more fit for purpose for the new situation. And in 1995, the World Health Assembly, which is the political body that that is effectively the engine of the World Health Organization, called upon the WHO, or the Secretariat, to revise the international health regulations in 1995. However, while stuff happened, the international health regulations were not actually revised for a very long time period. In fact, it wasn't until the SARS outbreak in 2003 that there was enough political pressure to update them. In particular, what happened during the SARS outbreak, which is, it was transmitted, began again in China, it began to spread around the world, and it ended up in certain countries, for example, my home country of Canada. And at the time, the WHO actually issued recommendations to avoid all non-essential travel to Toronto. However, that was interpreted more broadly, and there were huge economic effects on Canada, in particular the province of Ontario, that lost a lot of revenues either through trade or through travel as a result of that proclamation. And so there was a big question about, you know, did the WHO have the authority to even make a statement like that? There was no coverage of SARS in the international health regulations. So what's the deal? So following the SARS outbreak, there was a revision to the international health regulations. It was adopted by the World Health Assembly in 2005. This is a legally binding agreement. All 196 countries have now signed on to the international, state parties have now signed on to the international health regulations. And it came into force in June 2007. And I'm sure KG has that date very relevant at the top of his mind, given things that happened soon afterwards. So the goals of the revised international health regulations are to prevent, protect against, control, and provide a public health response to the international spread of diseases that is commensurate with and restricted to public health risks. It's very interesting language, and which avoid unnecessary interference with international traffic and trade. So you can see from this definition that the real rationale for this, right? The rationale for the international health regulations is to mount an effective public health response, but without interfering, if at all possible, with traffic and trade, because ultimately that is what countries care about, and that's what countries are concerned about. So while the international health regulations represented a very significant improvement upon previous versions, they still have a couple of challenges, and we're still learning about whether or not these are effective or not. One of the major changes that actually happened within the international health regulations revision was it actually gave the WHO, to some extent, much more authority to decide when trade and travel restrictions are in fact warranted in the context of an infectious disease outbreak. So within the IHRs, as I mentioned, this is a legal document. It is a set of laws. Again, countries have agreed to follow these laws. There are some provisions that are specific to trade and travel, particular travel. Article 23, you know, countries are allowed, if necessary, to impose additional arrival and departure examinations. You can think of this as screening that might happen at the airports, as well as additional health measures, which I'll come to. Under Article 31, you can also impose additional health measures related to people who are coming into your country if there is a public health risk. And this does include things like quarantine and isolation. Article 43 restricts measures that countries can impose to those that are supported by science, commensurate with the risks involved, and comply with WHO guidance. And this means, for example, respect of things like human rights. They can't be differential on things that are not based on science. And that countries who invoke these additional health measures must notify the WHO of these measures and provide the scientific rationale for why they're adopting them. So you can see that there is some language here that suggests that these types of regulations are potentially in compliance with the international health regulations, but it does require there to be, for example, scientific evidence. It does require there to be some sort of communication between countries and with the WHO about the use of these measures. And we'll come to this, whether we think this is actually happening or not. One of the major outstanding challenges with the international health regulations and a lot of legal frameworks that exist at the international level is that although they're legally binding, there's no mechanism to enforce them. And so it's actually very difficult above and beyond the WHO calling out countries to say they've done bad or done well to try to prevent any violations of these regulations. So that brings us today to COVID-19. As I mentioned, when the WHO declared COVID-19 a public health emergency in late January, it recommended against them on this basis that there just wasn't enough evidence to support them. Evidence from previous outbreaks, as well as some of these principles underpinning the IHRs. However, basically every country has now invoked some form of cross-border measure. These run the gamut of travel restrictions, visa restrictions, border closures, many, many others. This is a big departure from previous major outbreaks. So for example, during H1N1, we think about 25% of countries adopted some measures. Similarly, during the large outbreak of Ebola in West Africa, about a quarter. However, to date, the WHO has not challenged any of these measures publicly undertaken by any countries. There is widespread consensus, at least among the academics that are publishing right now in this area, that these measures don't work. And so if everyone who studies this thinks that they, quote unquote, don't work, and every country has adopted them, what's happening? And so that's where this research project that I'm working on comes in. We're trying to better understand what are some potential explanations of this policy diffusion and a variation that's happened across countries. Previous theories have pointed to, for example, the role of international norms as playing a role, or of domestic politics playing an important role in why countries do this. But I think it's clear that given this universal adoption, as well as the sort of widespread adoption of variation in them, these theories are not sufficient, and perhaps there's other theories out there that are helping to explain this. So if you wanted to go on vacation right now, it would be very difficult, right? Effectively, every border is quote unquote closed to some extent. It is very challenging to move around for emergency or non-emergency reasons anywhere in the world. Really interesting patterns in terms of when countries have adopted these things and sort of first waves and second waves, these things happening. They're effectively universal. And the other really interesting thing that we've started to identify is just the wide range of things that countries are employing. There's no such thing as one way in which countries are doing this. It's across the board. So just in terms of some research questions that we have, and we think that others might find interesting here in the context of what's happening here. We want to better understand these measures in terms of just even describing the sort of range of things that are happening. And while there's a lot of calls out there that say that these are all in compliant with international health regulations, that's actually a legal definition, and so we're quite interested in also understanding whether or not these measures are in compliance or not in compliance with international health regulations. It is quite possible, in fact, that many of them are. although there might be special concerns about, for example, the way in which there might be unequally being applied, citizens versus non-citizens, and that could be a challenge to the legality of the implementation of these measures. One of the big questions that come up is well, why are countries doing this, and are they getting any sort of benefit from it from a epidemiological perspective? And so we're actually doing a lot of work also trying to understand what do we know about the effectiveness. So no one has ever studied the impact of COVID-related travel restrictions, and that's because COVID didn't exist more than a couple months ago. And so is it possible to draw lessons from Ebola? Is it possible to draw lessons from pandemic influenza to inform this? Or do we really need a new set of evidence base to suggest that COVID might be different? COVID has different properties that make it different. And therefore we should understand that in our assessments of whether they work or not. In addition, most of the previous studies have only looked at the impact of travel restrictions in the early phases of an outbreak. But now, once countries have managed to get through first waves or second waves of the pandemic, there's a big open question about what the role of travel restrictions might be in terms of continuing to keep your outbreak under control. And so beyond these public health rationales, what are other explanations? And so we're interested in, we're doing some political science type work, thinking about understanding policymakers and what's driving their impact. And we're doing this both in sort of a qualitative and a quantitative type sense. I suspect that there's probably a lot of political pressure on countries to do something, but why this and why such a wide range of measures? And I think really importantly, when is it the time to start lifting these measures, and how can our work help to inform some of the decisions that countries are going to be facing in the coming months as they think about reopening their borders or allowing people to move about more and more. So I'll stop there, and I will look forward to your questions.
Okay, thanks, Karen. So if anyone has any questions, you are very welcome to put them in the chat function in Zoom, and then we can open the floor up for a bit more of a discussion. Okay. So to start us off with, I have a question about how useful the international health regulations are as a framework. So do you think that they are still useful? And do you think that they're still a useful framework, or are they dead as such?
Great, that's a great question, thank you. I think it is clear that the international health regulations are not working as intended, in the sense that I think if the goal had been to really minimize the impact of the outbreak on trade and travel, it is not achieving that goal. At the same time too, it's unclear what the better situation could have looked like or should have looked like. However, I think the fact that, despite the fact that there's no recommendation to do this that every country has, it has basically questioned the authority that the WHO has in terms of issuing these guidance. There had been an opportunity for them to, for example, challenge some of these, especially particularly early in the outbreak when they were being directed, for example, people from certain countries, or where citizens could come back from one country, but people, foreigners, couldn't come from those countries. But that window has kind of passed. And so I think there is a big gap there. I think there will need, I mean, every time there's a big outbreak like this, there's always an ongoing reflection about what can be improved upon by the next time. But I think, in particular when it comes to trade and travel regulations, it's clear that what this policy is intended to do is not working. And there's big risks going forward, for example, that the next time there's an outbreak of Ebola in Africa, we see the same sort of shutdowns happening, which are probably not warranted whatsoever. And so I do think that the current iteration of the international health regulations around this aspect of trade and travel is effectively dead and will require some serious reflection in the coming years.
And so with that in mind, if the international health regulations were to be redesigned, how do you think that this should be done?
Yeah.
What are the sort of key things that we would need to think about?
There are aspects of the international health regulations that have received a fair amount of criticism under previous outbreaks. For example, the decision by the Director General to convene the emergency committees and to make proclamations. There's been a lot of questions whether that mechanism is working correctly. But I think the trade and travel restrictions component of that has sort of received a sort of afterthought. And while there's a fair amount of openness around even some of the decision making around whether or not something constitutes a public health emergency, I think there's been a lot less at the level of discussion around whether trade and travel restrictions are warranted. And so I think thinking about some mechanism to allow for more input into that process is probably warranted. And I think also, I know there's a lot of desire to be confident and to be clear when communicating with countries about what threats are and what risks are. I think there's also some importance of realizing that we don't necessarily know the extent to which certain new novel infections might actually be a risk to transmission globally. And so having a bit more humility or ability to recognize that we don't know the answers up front, and that might be okay.
And so I have a question about, I guess we've talked kind of at an international level, how the international health regulations impact trade and travel, but in terms of sort of at an individual level, is there anything that individuals could take from this experience?
Yeah, I mean, I think an awareness and a recognition that these legal arrangements exist is probably important for the general public. I think, there was a lot of interesting ways in which public opinion or different voices likely contributed to national governments making the decision to try to, do this or do that. There were countries, for example, Canada, in which there was quite a vocal response in the newspapers in the early phase of the outbreak, suggesting that Canada should uphold its commitments to the international health regulations, and then that's a source of pride that everyone should agree to. And so, in the sense of, if we think these regulations are worth having, and these rules are worth having, and that we're all better off as a global community to have them, having a sense that they exist and that to uphold them, even at the sort of grassroots level, is probably an important step to that.
Do you have anything that you'd like to add?
Yeah, maybe just to add to a couple things on top of what Dr. Grépin said. What Karen's been talking about has really been probably the biggest advancement in public health in decades. The idea that countries would work together and that they could agree upon something like the international health regulations. And as she mentioned, it's really a very open question as to whether they've died, you know, whether they're still alive or not. And I think that it is inevitable that there will be a lot of discussion and assessment about this. But I think a couple of concepts are clear. One of them is that the idea that countries work together is absolutely essential. COVID is an outstanding example of what happens when you don't. Mm-hmm. And I think a lot of the difficulties that we face will one day get traced back to not being able to cooperate better. But I think going forward, the revision or revisiting the international health regulations is going to be a huge political process. Every country in the world will be involved. And the current versions of the international health regulations took about a decade to negotiate. And the outstanding question going forward is whether the negotiations will be fundamentally to improve international health regulations, or will it become a surrogate struggle between China and the US? The geopolitics of the current situation are unavoidable, and I think it's a really interesting question to see what happens, but this is probably the fundamental issue that countries are going to have to struggle with.
Yeah.
But one of the questions I did want to ask Karen, in looking at the international health regulations, do you think that they can be modified, or do you think it's going to really require almost starting from a different concept given the extent to which they've been disregarded?
Yeah, I think that's a really important question. I think that the regulations as they stand are probably the right starting point, in the sense that, I mean, there's been 150 years of efforts to try to develop regulations around, you know, what's happened, how to do with this. I think there's been tons of failures over the years, and so every time that there's some sort of major failure, the documents, when they do get updated, are updated in such a way to reflect that change. But I think that the newest version is obviously a much broader, much more interesting piece of legislation. But I think it still has so much of, it was built to respond so closely to SARS. And it doesn't always apply in many circumstances. So I think there needs to be some sort of tailoring of them to know when some types of risks, sometimes the threats might require different types of modalities. And then I think the other really important piece to this is, because there is no enforcement mechanism, there's no real way to I mean, there are, but no one has really used them in any real way, that piece needs to be solved. Because without that, I think, you know, it's the same story from before. It's like, these rules are fine and dandy until they apply to you. And that's effectively what's happened here. And so when that happens, all bets are off, and there's no point in playing by the rules anymore. And so I think that the basics are there. I think it just needs some modifications to make it work in context. But, you know, who knows? But that's totally my perspective on it.
Okay, so we have a question from Christopher about lifting restrictions. So it's not practical to shut down borders forever, and we see no cure for COVID-19 in the near future. So under what circumstances can governments lift travel restrictions?
That's a really good question, and I'm sure that's the question that so many countries are facing right now. I'll tell you, I don't think the international health regulations actually give us much guidance on this. So in that sense, you know, coming from that, I don't think it necessarily informs this question, which is a completely different question, which hasn't really been given as much serious thought before. for the most part, outbreaks were largely contained or didn't materialize into what they were likely to become. So, you know, the decision to give up was much easier to make. COVID's different. Like, we have no sense of what the future is going to look like. We're here in Hong Kong. If I were to go around and ask all of you who are on the line who also live in Hong Kong, how do you feel about travel restrictions? I would say there's probably pretty widespread support of the fact that our borders are, quote unquote, controlled. They're not closed, but they're controlled because of these additional health measures that we have in place. You know, when we were writing this grant, I was working with scholars around the world, and they were like, "Oh, travel restrictions don't work." And I'm like, "Yeah, but I woke up this morning and I was really happy that our border was shut this morning." So, in that sense, I think you know, people right now, there's a willingness to want to keep them in place. I think, you know, I think once the other aspects of public health are at the stage where countries or jurisdictions, Hong Kong's not a country, but jurisdictions that are able to feel like that they're ready to open their borders, and that if there are some imported cases, that they're able to adequately control those. I think that might be one thing, but it is a purely local decision on this. I think there's no guidance from the International Health Regulations as to how this should be done. But, you know, again, here in Hong Kong, where our lives are starting to go largely back to normal because, you know, all the cases that we've received in the last couple of weeks, even a couple of months, have effectively been imported cases and caught through the additional health measures that are in place. I think there's also needs to be some recognition that there can be a role for some of these measures to keep this outbreak controlled in localized areas in the future.
Okay, so we've got a couple of questions that have been sent in. So, so I have one over email. So, so you've mentioned that the regulations are legally binding, but there are no mechanisms that force countries to adopt these measures. So compliance might vary from country to country, and most countries carry out these measures individually with the impact or origin of COVID still unknown. How can consistency and effectiveness be guaranteed? And will there be any consequences if countries fail to comply?
So I think in the context of COVID, the answer is no. I think it's too late at this point to now go back and say that travel restrictions, when they are not in compliance with the international health regulations, should be removed. I think at this point, when everyone is effectively doing it, the norm has shifted so much that it would be challenging to fight with that norm. But you know, I think there needs to be some broader recognition. I mean, there are international health, there are international regulations and international legal documents for which there are enforcement mechanisms. And in fact, we've seen a couple of countries, for example, think about expanding some of those things. Even some legal challenges to the international courts. So I think going forward, this need for some sort of mechanism is important. But at the same time, too, the reason the world developed these international health regulations is that there was at some point some belief that we were all better off if we cooperate with one another, if we coordinate together. And so finding ways to reignite that feeling is going to be important in this as well.
And so you talked a little bit about quarantine regulations. So I have a question here about what do you think about the confrontation between the value of personal interests and quarantine regulations?
Yeah, I mean, this is effectively what quarantine means, that we can limit the freedom of a few people in the interests of public health. And you know, when quarantine was being implemented widely in countries around the world, you know, a lot of people were like, "Oh, this is such a medieval policy. How on earth could we actually be bringing it in?" But it turns out it generally works pretty well, right? Like in the sense of, you know, we haven't been able to come up with much that's much more effective than just literally letting people sit around and in isolated from others until the threat has emerged, and it tends to work. I think what's important, though, is that it's done in a way that is not otherwise inconsistent with aspects of the international health regulations. For example, equal application of it to different groups. It's done in a humane way, that people are not, you know, exposed to things that they wouldn't be otherwise exposed with. I mean, quarantining people on a cruise ship, that's, you know, not a great idea, we've discovered. But doing it in such a way in government facilities and whatever is probably a more humane way of, if we have to do it, of how it can be done.
So that probably links quite nicely to this question, actually. So we've got a question here. Again, is that we don't have a cure yet. So would achieving herd immunity be good options for countries to then be able to lift travel restrictions? Is it possible to achieve this kind of approach?
So I'm not an epidemiologist, nor am I an immunologist. However, I think there's some misconceptions about what the term herd immunity means. But I think, you know, we're learning that, you know, now probably 5–10%, I don't know, of populations in major urban centers around the world have been exposed to this. I don't think we're at the level of herd immunity. So I think it's still a bit premature to be talking about, you know, whether that's sufficient in order to, you know, be a reasonable substitute for some of these travel-related measures. But again, I would probably leave that to an epidemiologist or to a virologist to give us a good answer on that question.
Okay. Hey, do you have anything else that you wanted to add? If not, I think we'll move on.
No, just to, well, actually to go back to one of the issues which was raised by Karen in her discussion, it's true that the international health regulations in essence don't have a enforcement mechanism. So it's frequently pointed out as a drawback. But then the question comes up, why have they worked in the past? And they have worked in the past. And I think one thing that's important for everyone to understand is that among countries, peer pressure is an enormously strong reason why countries have complied with the IHR. And it's why even when countries have not complied, they in general have ended up explaining to WHO why they have not. But again, in keeping with COVID and the breaking a lot of different norms, once travel restrictions were broken quite openly by a number of different countries, everything sort of fell apart, and that peer pressure has disappeared. And so it's an important point to sort of ponder over, because in the past, countries have been really reluctant to incorporate any legally binding enforcement, because basically they know that they don't want to comply with it at some point. And so how countries deal with this in the future negotiations, again, is going to be one of the most difficult and most important aspects.
Okay, so I'm just going to take one last question, and that probably links quite nicely to your point. So there are experts raising the possibility that the pandemic might eventually turn into an endemic. Hence, the virus may last for centuries or even longer. If this situation is true, will there be a risk that there may be a new wave of the disease spreading internationally? Is it possible or necessary that governments implant laws or put restrictions like distancing or quarantine for a longer period? And how would this affect society in the long run?
Yeah, I mean, I think yes, in the sense that I think this is likely to be with us for a very long time. I think we don't know what the future holds. I think even, here in Hong Kong, we've been through a second wave, which was, largely the result of the fact that we imposed these travel restrictions, knowing that they were happening. Everyone rushed back at once. However, at the same time, that allowed us to predict that this was going to happen and prepare. And so in some ways, it was not a bad thing. So I think, going forward, I think it's very much an open question about, what it will take. I mean, there's a lot of unknowns. Will there be a vaccine? Will we be able to find other ways to deal with it and cope with it? I think right now, the amount of international travel is so limited. It would take a lot for there to be like a massive new surge in travel-related cases because nobody's traveling. But, this can't go on forever. So when that happens, that will be the risk that countries will face.
Okay, great. So thank you everyone for all of your questions. So before we wrap up, I'm going to hand over to KG, and he's going to talk to us a little bit about how what COVID-19 means in terms of health and development more broadly.
Thanks, Danny. Everyone, I'm just going to take a few minutes and give you a broad take of what we're going through with COVID, and then how it does relate to the Bachelor of Arts and Science degree, which Ryan Aoyang and Danny will be talking about in a few minutes to go into more detail. But just a couple of observations. I think that there are about 1 million lessons that COVID is teaching us, but I just want to point out a couple of them. One of them is that everybody in the world can see right now how health visibly can impact the world. It has done so for eons, but oftentimes in invisible ways, and now it's very visible. And so if you remember and take yourself back to January when we first started hearing about this, a lot of the focus was on counting cases. How many cases are there? Or what do we know about the virus? And so we really started with a focus on the disease. But as we've gone forward over the last couple of months, in essence, we've seen that COVID has taken over every aspect of society. We talk about it as an economic issue. We talk about it as a daily life issue, as a personal issue, as a mental health issue, and so on. And one of the things which has become clearer is that there is nobody, no country, nobody who is really going to dictate any of the solutions, how we deal with these things. And it really points out how if you're going to deal with something that you have to, and which is complex, like COVID, you have to bring together a lot of perspectives, you have to bring together a lot of people, and you have to bring together a lot of options for solving something to really agree upon solutions. So what COVID has put into play is an enormous number of things. This is just a few of them. We have a lot of discussions about how do we control the outbreak. So some of the questions coming up about travel right now. We have a lot of discussions about the health aspects, not just the physical, but the psychological. A lot of discussions about the adequacies or inadequacies of health systems. When are we going to get vaccines? When are we going to have medicines? Everybody can see that societal norms are being reshaped right now, societal norms and culture. So how we conduct daily life if our kids are not in school, or if our workplaces are not open, or stores are not open. The changing over of physical meetings to electronic meetings, the inability to travel, whether you think wearing a mask is a good idea or not, depending on whether you're in the West or the East. A lot of discussions about individual rights versus public safety. In a number of countries, electronic monitoring has been done to help do case finding and contact tracing, and whether those means will continue after COVID. With the vaccines coming up, we will be changing over to discussions about who should get vaccine first, and this will be a difficult discussion. In terms of systems and economies, again, in many ways, COVID has pointed out where societies are vulnerable. If you don't have a good safety net for people, what happens when 10% of the population stops being able to work? A lot of concerns about food supplies, and if you're in the business side, manufacturing, supply chains have been disrupted, so you can't get the elements and things that you need to work. And then there are a lot of discussions going on a daily basis, which it's hard to tell. Are these strategic discussions? Are these public health discussions? Are they really political discussions? What does normalization mean? How quickly do we proceed with it? We have a lot of demonstrations going on in different countries, some saying demonstrating for different rights and so on, discussions about border openings, and then the geopolitical tensions raised or exacerbated by COVID are unmistakable. But on the flip side, we've also seen on the planetary health side, in some ways pollution has come down, potentially global warming has been slowed a bit. In some places, instead of driving in cars, people are riding bicycles much more. And so what we're seeing going forward is that virtually every aspect of how we live is now being called into question or challenged or changed. So this is a bit of a segue into what Ryan and Danny are going to be talking about, but at the school, we have launched an undergraduate program, a Bachelor of Arts and Science degree in something that we term Global Health and Development. And we started this a few years ago, way before we knew about COVID, but the basic idea of it reflects a lot of what we're seeing in COVID now. In essence, the idea of this program is that if you're interested in things like economics or development or global health, all of these things are interrelated, and that you have to understand these different perspectives. You have to understand how they're linked. And so it's an interdisciplinary program put together or supported by 6 faculties led by the School of Public Health. There are a lot of ways in which the people running the course work with students, so lectures and tutorials and so on. And in addition, there are some other Bachelor of Arts and Science courses or programs which are underway, but they do share some overlap. And the areas of overlap is common approaches to teaching about leadership and about the use of things like big data and knowledge. Finally, a main feature of our BAFC program, the one in Global Health and Development, has to do with going overseas for 6 months. So, in essence, this is a really very interesting, I think very attractive option for certain people. In terms of the kinds of things that you will learn, there are key concepts and areas and topics that you will spend some amount of time thinking about and learning about and discussing, having to do with health and global health, what globalization means, what its impact is, systems, technology, who are the players in the international arena and national arena, and what are their roles in terms of the modern world and global health and development. Some of the courses will be taught by various faculties. Some of them are taught directly by the School of Public Health, but again, it reflects the multidisciplinary nature of the program. One of the key things that we are very concerned about for the students that are taking this is that after you leave school, no matter what you do, there are some competencies and skills that you're going to really want to have acquired. One of them is simply the ability to interact with other people. If you accept the idea that the world is becoming increasingly linked, and you're going to be working with people who have had different trainings, come from different countries, different perspectives from you, just interacting with people is a really basic and fundamental skill. And it may be the single most important skill that you learn in education. A second one, though, is that it's important to learn how to voice what you think is important, to be an advocate. And finally, bringing others along, working with others, all has to do with the concept of leadership. There are many different ways to lead, but the idea of leadership so that we move in certain directions is an important thing for you to learn. As I mentioned, an important part of the program is to go overseas for 6 months. This is done in the 4th year, and I think Ryan and Danny will talk more about this, but the basic idea is that we want the students in this to get exposed to a real-life working environment. Part of that is just to understand, what do people who really work in a field think about, talk about, focus on. Part of it is to get mentoring, and part of it, since it's overseas, is really to have an international and multicultural experience. So what we are doing, or what we have done, is begun to set up arrangements with a number of different organizations. Some of these are in the United Nations, so various agencies like UNICEF or the World Health Organizations. Some of these are private, non-governmental organizations. Some are consultancy groups, and so on. So on the right-hand side, you can see the kinds of organizations that have agreed to work with us on this. And they are in many different locations. So in Asia, in Europe, North America, and so on. Finally, a lot of times are asked, well, if I do this, what am I going to do for my career? What kind of job am I going to have? And so I'm going to not give you a straightforward answer, because I can't tell you what kind of job you're going to do. But I will tell you some of the things that we will try to work with you on, because you're going to need them in terms of selecting your career directions. There are a couple of essential things that are important for everyone going forward when you're looking and building a career. One of them is to have an education base, and in developing that education base, to acquire something that you contribute. If you're going to work with a group of people, you need to bring something to the table. A second thing that's important, which we'll work with you on, is for you to understand, what is it that really motivates you? Are you someone who's primarily interested in a good quality of life? Are you motivated by your family? Are you motivated by working with a sense of mission? Do you go with your passions? Do you like things because they offer a big challenge? Do you like things because you think you have a good chance of success? And then to understand whether you're interested or whether you're comfortable with high risk or low risk kinds of careers and directions. And then after that, you're going to have a lot of things to think about. You know, what's the field of interest for you? Do you want to work on policy making, decision making, sort of an executive process? Are you more interested in the process itself, sort of management or administration? Are you interested in becoming an expert in an area? And then there are different kinds of jobs, whether you work in the government or the private sector. And then finally, you know, you will be thinking about whether it matters to you to stay at home or whether you want to go abroad and work. So, you know, given all of these kinds of things that you will be juggling over the next number of years, I think it's way premature to say what it is that you'll be doing, but we will be working with you and thinking and helping you to think through some of these issues. So this is information for getting further information. You're going to hear more further information now anyways, but So let me stop here. Thanks.
Okay, great. Thanks, KG. Okay, so I think we will be back in about 10 minutes, and then we'll have a bit more of an in-depth discussion about the Global Health and Development Programme, the overseas field placement, and admissions for JUPAS students. So if you have any questions about the programme, you can join us in about 10 minutes, and we can answer those then. So that's it from us. So thank you everyone very much for joining us, for all of your questions. You can follow us on social media. That was on the slide before, and stay up to date with all the latest news from the programme and the School of Public Health. So yep, thanks for joining us, and hope to see you again soon. Thanks everyone. Bye.